I don't think people understand like NICU is a different level of than just being like a nurse. So how do you become a NICU nurse?
Ooh, good question. So, my NICU, my hospital, my children's hospital, we have a there's a couple of ways. So I'll start with how I became a NICU nurse. I went and got my degree, and then our children's hospital has a nurse residency program where you can go directly from being a new grad nurse without any experience into this residency for your specialty. And so we have NICU, HEMOC, PEDS ICU. Not sure if the emergency room has a residency. Um, they may or may not. I'm not sure. They may have a different kind of program, but acute care peds, adolescents, where you can go in as a new grad, you apply, and you interview, and then you get chosen and you can get into your specialty that way. But that's a very select few. Like there's only so many spots. It's highly competitive. I happened to meet who was the director of the NICU back then, and she's like, "I want you to come in," and that all worked out great for me. Let's say you apply and you don't get in, you go out and get experience. It could be adults, more than likely it's going to be adults like med surge or whatever. There's a huge nursing shortage right now. So pretty much any nurse that has any type of experience can apply to a NICU and probably get in right
Wow.
now. Yeah. So we are actually like, if you have a year of adult experience, adult med surge, and you apply to the NICU, you can come in and then we train you. So you don't just come in and become, you don't just start off as a NICU nurse. So once, whether you get into residency or you come in as an experienced nurse, you have time with a nurse preceptor to teach you how to be a NICU nurse because it is a little bit different than adults. Well, it's a lot different than adults. So just NRP, how we resuscitate our babies is completely different than a PEDS unit. They use PALS, or adults use ACLS. So you get your certification, you learn how to resuscitate. So let's say you have a nurse, they come in, a unexperienced new grad nurse goes through 16 weeks of residency, where they start at the very beginning and learn all the way through. And then they kind of go on their own. They usually get the easier kids and then you build on your knowledge and your skill set. And the same with the experienced nurses. They all come in with a different variety of experience, but we got to teach them how to do medications, how to do feedings, and the pathophysiology of the NICU, right? Why is that kid there? Is it just a preemie? Is this a surgical kid? Is this a brain injured kid? So you learn all of that. So an experienced nurse will probably precept anywhere from 8 to 12 weeks with an experienced nurse. And then if they feel like they need more, they can always ask for more time. So that's how you get into the NICU. And like right now, if you want to get into the NICU, it's probably the time to get into a NICU because there is a huge nursing shortage. We're hiring like crazy right now.
I know there's different things that you guys do, cooling and different stuff. Does everybody have to do an extra like training to do all of those extra little things?
Absolutely. Yes. So we are a level 4 NICU, so we take everything. So cooling is a specialty. We go through didactic and then actual skill set training. And in an ideal world, we're partnered for those first few babies that we take in cooling. Well, we're mentored with an experienced nurse who's had cooling experience to ask questions and things like that. And then we have ECMO on our unit as well. People have been hearing ECMO with COVID for adults, but we also do ECMO on kids that have some type of lung damage, sometimes a cardiac defect as well. And so we have an ECMO team as well. And that is a very specialized education process as well. And both cooling and ECMO require you to have a couple of years of NICU nurse experience before you can even apply for that job. And then it's an interview process as well. And then we have one other specialty in our unit, which is transport nurse. So we have nurses that are skilled in transport that go out to our outlier hospitals that aren't as high a level and go get those sick babies and bring them back to us, whether it be ambulance or helicopter or airplane.
Is there any types of deliveries that NICU is either present or waiting on? just to basically make sure the baby's good kind of thing.
Absolutely. So, our moms that are admitted to antepartum, if their babies are below term and they're admitted for monitoring for whether it be the mom or the baby, we do introduce ourselves to them and talk to them. If I have a mom that comes in and she is a TOLAC, a trial labor after cesarean, I might be aware of that, looking at that. Twin deliveries, any babies with congenital anomalies, we're going to be aware of. And yeah, anything. We go to every cesarean at our hospital. We have an assigned person, an assigned respiratory therapist that goes to those deliveries as well. Just because, cesarean babies can have a hard time breathing afterwards. So we go and assess them. Our goal is always to give them back to the moms as fast as possible, but sometimes they struggle. And so we might just watch them in our resuscitation room up to 4 hours. We're allowed to watch children up to about 4 hours, like even sugar babies. Like if we can get their sugar stabilized, we'll try and get them back to mom before we have to admit them. So yeah, we're at those deliveries.
How common do you see transfers from out of hospital births?
Oh, we see them. I couldn't tell you how often, but we see them. If we see them. In fact, I heard them just this week. Someone say, our so on our unit we have a charge nurse, but then we have a nurse leader, a TL, who does all the bed assignments and does all the nursing assignments to the beds. And I heard her get a phone call and she's like, was that a planned home birth? I just walked away. I was like, I don't even want to know. Like, I don't even want to know. I don't want to know.
What is allowed and what is not allowed inside a NICU?
I think it depends on the NICU. My NICU, we're pretty strict because the way we're set up. So we have 14 rooms, anywhere from 3 to 6 babies per room. So there's not a lot of privacy. So we don't allow any videotaping because our doctor's around at the bedside and you might hear a whole story about Joe over there, right? And we have a lot of social stuff. So if you are videotaping at the bedside, you better be talking to your nurse. All right. So if you want to send grandma a video, you better ask your nurse. And I'm going to survey the room and go, yeah, you're the only one in here. Go for it. Right. Or I'll be like, no, I'm sorry, you can't do that. We also try to discourage people playing on their phones. It's really hard. For a while there, we had no cell phones at the bedside rule, but that's really hard to do now because phones are our cameras. And the reason we didn't want cell phones is infection, right? They're as dirty as money. So now we encourage people to wipe them off. We put them in plastic covers. And I'm a nurse. I use my phone. My kids text me. Like, please don't ask me to not have my phone. I do carry an Apple Watch. I put it up on my elbow. So if I get a text, I can see if it's from my kid or whatever. So we're getting a little bit better about cell phones at the bedside, but we don't want you sitting there playing games at the bedside. You're supposed to be there visiting your baby and interacting and bonding with your baby. So that's really kind of discouraged or frowned upon. It depends on the nurse. Phone calls at the bedside, complete no. If you get a phone call from whatever, we just asked you to kindly step into the hallway and take that phone call and then come back in. Always when you enter the NICU, it's a 3-minute scrub up to the elbows. It's for infection control. So if you check in at the front desk and you immediately come to the bedside, I know you have to wash your hands. So I'm going to ask you to go do that. Don't be mad. That's the rule. We have what's kind of nice now is we have QR codes for all of our physician teams and all of our physicians. So if they have a question and they haven't talked to the doctor, I'm going to have you take your phone, go to that QR, and you can shoot that straight off to your doctor right there. So that's kind of nice. We are only allowing parents at the bedside with one visitor at a time. So you can have 2 visitors total at the bedside and one always has to be a parent. And the reason we're not allowing any more than that is just space. Like we have 6 babies. So you have 6 babies in there, at least 3 nurses in there. If all of those babies have a parent, that's at least 6 to 12 more people in the room. Plus you have your physicians, your respiratory therapists. We really, it's not that we don't want lots of family coming around. It's just that we can't accommodate it. So, and that's just because how our NICU is. Now, other NICUs, I think they have private rooms. They let as many people in as they can, but we are not set up that way. Our NICU was built in the 80s. It's still really old. It's, it's crowded. And with COVID, we really try to limit the number of people coming into that space.